As the World Health Organization, WHO, takes stock of the coronavirus pandemic about 22 months since the outbreak, 5 million deaths have been reported and the number of new infections and deaths continue to be on the increase. The World Health Body believes this was not supposed to be the case 1 year since the approval of the COVID-19 vaccine, putting the blame squarely on lack of implementation and cooperation amongst various stakeholders.
We know the real number is higher. We're still losing more than 50,000 of our sisters and brothers every week. Last week, 56 countries from all regions reported an increase in deaths from COVID-19 of more than 10%.
In an effort to beef up the vaccine availability to ensure equity of supply and access to all, the WHO added a new tool, COVAXIN, for validation, safety, efficacy and quality with the emergency listing unit. This will become the 8th vaccine aimed at saving lives around the world.
Yesterday, we added another new tool with the emergency use listing of COVAXIN, the 8th vaccine to receive WHO validation for safety, efficacy, and quality. Emergency use listing contributes to vaccine equity by enabling countries to expedite their own regulatory approval to import and roll out vaccines.
The WHO had therefore appealed to world vaccine manufacturers to ensure smaller countries, especially those with low income, are given preference through COVAX and the Africa Vaccine Acquisition Trust. The WHO, together with the World Bank, has established the Global Preparedness Monitoring Board, which recommended that world leaders and other stakeholders cooperate to find solutions to the pandemic.
We call for greater funding for WHO, more support, more accountability, and more authority. This is not a favor that we are doing to WHO. It is, because we care about global health and we care about the support that is required and that needs to be given to countries. We believe that a much stronger funded WHO with greater authority out of the geopolitics positioning is the way to go. And that can also make the organization more accountable, and then we can all be more demanding vis-a-vis the organization.
He states that all lives live in a shared world with shared risks and shared responsibilities, explaining all their efforts should be well coordinated to match the magnitude of the pandemic. Jeff Tachihomino, NBC News, Windhoek.